Last week, ASA held its annual Future of Aging Services Conference in Washington, D.C. This conference, unlike the ASA annual meeting, focuses heavily on advocacy and includes visits to Capitol Hill for members to share their wishes and concerns with their members of Congress. Even if you weren't able to join us in D.C., there are many other ways that you can join our grassroots advocacy efforts and make sure that you and your issues are represented on Capitol Hill. ASA's Contact Congress program allows you easily to look up information on your senators and representatives, and with a click of the mouse, you can send them a letter on various issues that are important to you. It only takes a minute of your time, but the outcomes are immeasurable. Currently, on Contact Congress, we have HCBS-related letters posted on the need to support a 6-month extension of increased federal funding via the FMAP, a letter on the good and bad components of the President's 2011 budget proposal, the need for more funding for meals programs that support older adults in the President's budget, and a request for the passage of the Medicare Adult Day Services Act of 2009. Before you jump on the computer, let's go over a few basics on these issues. In relation to the FMAP increase, the American Recovery and Reinvestment Act of 2009 included increased federal Medicaid funding for states hit by falling tax revenues and increased demands for Medicaid coverage due to the recession. This increased federal Medicaid match is due to expire December 31st, 2010. Unfortunately, most states still face dire budget situations. Medicaid generally is one of the most expensive programs in a state's budget, so when spending cuts must be made, the program becomes a prime candidate. States cannot eliminate Medicaid coverage of services mandated by federal law, but they can cut back on optional services such as adult day and other home and community-based programs. States also have cut back on reimbursement to healthcare providers participating in Medicaid. If the increased FMAP is not extended, many states risk the potential of falling off of the Medicaid cliff. In regards to the President's budget proposal, we are pleased with the 7.4% increase in funding for Administration on Aging programs in the President's proposed budget, especially since most of the funding went to services such as in-home care, adult day services, and transportation under the Older Americans Act programs. The President's Caregiver Initiative increases Title IIIB supportive services by 13% and the National Family Caregiver Program by 31%. However, we are not pleased that funding for social services block grants were cut by $286 million, a 13.5% cut from 2009. The letter on the President's budget also includes items on the need for ASA members to receive the regular Medicare payment update in 2011 and items on Section 202 and affordable housing. For ASA meal providers, President Obama's proposed 2011 budget contains some concerns that the 1% increase in funding budgeted for the Congregate and Homebound Meals program will not address the existing waiting lists and increase in demands for meals by older adults. Also, there is a concern that the additional funding for the meals programs from the American Recovery and Reinvestment Act will be gone by 2011. Older adults that receive meals in 2010 will be denied meals in 2011 because of a lack of funding. Finally, the last but not least HCBS letter on Contact Congress is on the Medicare Adult Day Services Act of 2009, which would add adult day services as a provider of post-acute care under Medicare. This legislation would allow Medicare beneficiaries to use adult day service programs that are certified, licensed, or accredited under an approved accreditation agency to provide post-acute services under Medicare. Also, the battle for healthcare reform is not over. The healthcare reform letter on ASA's Contact Congress page encourages members of Congress to pass the class provisions and HCBS provisions, including the Independence at Home Act, the Community Choice Act, and the Empowered at Home Act, both of which would assist ASA providers in continuing to provide quality services to older adults across the country. Now, you are armed and ready to advocate for issues that could affect you and the people that you serve. Jump on to asa.org and click on Contact Congress on the right-hand side of the page. If you couldn't be with us in D.C., your obligation to advocate for these important issues is just a click away.